Eyewitness News is your vaccine authority, and as the school year comes to a close and we begin returning to normal, many of you have asked us about face masks, COVID variants, and the risks for vaccinated adults and children. Joining us live to answer your questions, Dr. Virginia Bieluch, Chief of Infectious Diseases at the Hospital of Central Connecticut. Dr. Bieluch, always good to see you.
Great to be here again.
All right, so first question, let's get right to it. If my child is safely vaccinated, can he go to an overnight camp where kids are not vaccinated?
Yeah, it's a great pleasure to be able to talk about camps this summer. Hopefully as many campers and staff are vaccinated as possible. The Center for Disease Control has issued guidelines for camps, and I think they're going to be updated probably before camps, but the guidelines are aimed at having as safe an experience for your children as possible. Children shouldn't go to camp if they're feeling sick. Hopefully camps are checking symptoms daily and have the availability of testing. The CDC guidelines call for cohorting, wearing masks as much as possible, except when you're eating or swimming, physical distancing of campers, and keeping the children outdoors as much as possible. So I think if camps follow those guidelines, your children are going to be pretty safe going to camp this summer. But please get them vaccinated if they're in the right age range.
They burn a lot of energy outdoors too, so it's a win-win. All right, next question, and this is definitely appropriate because we have Memorial Day weekend coming up and then the summer travel season. Should vaccinated people still get tested before and after traveling?
We have to look at the recommendations of the states where you're traveling to and from. It's recommended, at least in Connecticut, that you get tested, but right now there's no mandate that you get tested if you've been fully vaccinated. You're considered pretty safe.
All right, good to know. And last question for you. If a fully vaccinated person is exposed to a variant, will they still experience symptoms? And can a fully vaccinated person still get COVID?
Great questions. These vaccines are incredibly effective at keeping you from getting severe COVID disease, from ending up in the hospital, and from dying. They're really wonderful vaccines. With the variants around, we are learning a little bit about them. We're learning that the vaccines have some efficacy or effect against these variants. Could you still get sick? Yes, you can still get mild infection. You can get asymptomatic infection, but you're probably, at least with what we know currently, not going to end up in the hospital with severe COVID-19. So again, incredibly effective vaccines. We can look at a sports team that many people are interested in, and the vast majority of the COVID-19 infections in the Yankees have been asymptomatic. So these are great vaccines. No vaccine is 100% though.
We are moving in the right direction. You're always a wealth of knowledge. We love having you with us, Dr. Bieluch with the Hospital of Central Connecticut. Thank you so much as always.
Great to be here again. Thank you.
You're welcome.